Hello, everybody. Welcome to our lectures on psychedelics and psychiatry, the past, present, and future. I am Fernando S.P. Forsen.
And I'm Matthew Brown.
Well, first of all, I want to thank everybody for coming to our lecture yesterday. It was successful, people were interested, and we really appreciate your attendance and your interest. So, based on that, and also especially to help the people that couldn't come to the lecture, we have decided to make this video and upload it on YouTube for the pleasurable view of everyone. So, let's start.
Okay. So, psychedelics have been used by humankind for thousands of years. Perhaps one of the earliest evidence that we have is this cave painting that you can see in the left-hand image and the rubbing on the right of a bee shaman. This is from Algeria, approximately 5000 BC-ish. If you can appreciate, this image has multiple different mushroom-shaped protuberances coming out of the shaman, indicating that perhaps that healer was under the influence of that substance when working in the ceremonies. Additionally, we have evidence that mushrooms in particular, and perhaps other psychedelics, might have been used for religious purposes, and also within the Christian church, it has been documented in at least two books, one by John Marco Allegro, who was one of the only non-affiliated scholars to study the Dead Sea Scrolls. He wrote in his book, The Sacred Mushroom and the Cross, about how that there is extreme evidence that perhaps Christianity was indeed more of a mushroom cult. Additionally, Jerry Brown wrote a book called Psychedelic Gospels that shows a number of different religious iconography indicating psychedelics. In this image that you see here, this is Adam and Eve in the Garden of Eden, and if you can notice, the tree of knowledge depicted in the middle has a very peculiar mushroom-like shape, perhaps reminiscent of the Amanita muscaria mushroom. Additionally, another image we have here is of the St. Eustace window, also from France in the early 12th century. This is St. Eustace in the middle. You can see there are a number of different mushrooms surrounding him, and God is reaching down from the sky, communicating with him. It is perhaps postulated that Eustace imbibed the mushroom in the forest, and that's what gave him this religious experience. In modern times, the use of psychedelics can probably be tracked back to this gentleman. Albert Hofmann was a research chemist, working at Sandoz Pharmaceuticals. Somewhere around 1941, he synthesized a compound called LSD-25 that he didn't really think much of, but then a couple of years later, in 1943, he was experimenting with it again. As the story goes, he got some on his fingers, perhaps, and he started to feel a little bit odd. He rode his bicycle home to take the rest of the afternoon off, and during his journey, he saw a number of different hallucinations, which he thought were quite odd. And he seemed to trace this back to the substance he was experimenting with, noting that perhaps we need to research this more to explain what was going on. He and Sandoz shipped the LSD-25 to a number of different institutions, one of them being in Prague in the Czech Republic. At that time, this gentleman, Dr. Stanislav Grof, was a medical student and was involved in experiments where researchers were giving medical students LSD in hopes of teaching them more compassion for patients with schizophrenia. At that time, they were referring to the substance as more of a, quote, psychotomimetic, as it were. And he had an extreme experience and found that this was very interesting. After graduating medical school, he decided to research it more. And during his time in the Czech Republic, was involved in over 2,000 LSD dose experiments with patients. After leaving the Czech Republic in the 1960s, he came to Maryland, first was working at Johns Hopkins, and then was promoted to the head of research at the Maryland Psychiatric Center. He was planning to expand the research on LSD and other psychedelics, but unfortunately, shortly after he got there, President Nixon announced the Controlled Substances Act. We're familiar with this as this created the various schedules of drugs that we have. putting LSD and other psychedelics in the Schedule 1, meaning that it had no known medicinal benefit and a high potential for abuse. Unfortunately, due to this, almost all of the research projects got shut down, and we were not able to continue the search. To drive this point home, this chart here notes the number of different scientific articles published, in this case about psilocybin. If you can note, starting in the 1950s was the main interest, and it started to spike around late 1960s and then started to decline dramatically in the 1970s with a lull in the 1990s. As you can see towards the right-hand side of the graph, we are now in a resurgent period in the mid-2000s here with a number of different publications. This resurgence is generally tracked back to this gentleman, Dr. Rick Strassman, when he was working at the University of New Mexico. Dr. Strassman was interested in the pineal gland, and at first he was looking into melatonin that was secreted there. He postulated that this gland must be doing something else, because why would you have a singular gland secreting a singular hormone? And he came up with the idea that perhaps we also produce a substance called DMT, or dimethyltryptamine, in the brain. This substance has been postulated to explain a number of different phenomena, from near-death experiences to dreams, and even possibly alien abductions. Dr. Strassman did get approval to provide DMT intravenously to approximately 60 healthy volunteers. This was more of a safety study, and he just documented the effects that it had on the system, as well as the patient's subjective report.
Like Matt was mentioning, Grof proposed that these medicines can be helpful as they can be serotonin agonists, and they can have an action enhancing serotonin. So as we know, serotonin, an increase in serotonin, can help us and can help in the treatment of improving mental health. So these medicines is postulated that the mechanism of action is that they are non-selective serotonin agonists. But not only these medicines can be helpful in the treatment of anxiety, that is the thing that we're going to discuss today. These medicines cause transcendental experience, disintegration of the ego, and a dissolution of the self, and a feeling of interconnectedness, and a feeling of belonging to something bigger than ourselves. So there is a study with functional MRIs doing with healthy volunteers, that it was found that those people, those healthy volunteers that had a sense of connection with something bigger than themselves, or a disintegration of the ego, they had a lack of blood flow at the areas marked in this image, which is the retrospinal cortex, the parahippocampal cortex, and the medial prefrontal cortex. So it's been postulated that these areas may mediate the perception of the self and the ability for a person to see where you are as opposed to the world. Where is yourself located in the world or in the context? Also, these medicines have been thought, people who take it have been reported that they are able to retrieve memories and have a sense of being able to enhance their own creativity and be able to retrieve memories and things that they can connect ideas that they were not able to connect before. And actually, studies done with neuroimaging, we have been able to see that the sense of interconnectedness network is enhanced in people taking the medicines like psilocybin, which is the medicine that you get from the mushrooms, versus the placebo. Functional MRI studies with healthy volunteers also have found that there is a decreased reactivity in the amygdala. So having a decreased reactivity in the amygdala is one of the theories, together with the serotonin agonism that we were discussing earlier. Those two theories would support the use of these medicines in the treatment of anxiety and depressive disorders. And this actually has been taken into research already. There is a study with Gasser et al. That they use LSD-assisted psychotherapy in 10 patients. So what they did is they did 6 to 8 psychotherapy sessions to prepare for the patients for the LSD intake. And after that, it was followed by 2 intakes of LSD. And what they found, and this was done in patients who had cancer, and of course, it would make sense, because when you have cancer, you have an ontological, eschatological anxiety of not knowing what is going to happen after you die. So this type of anxiety could be hypothetically relieved by these medicines that enhances the feeling of transcendence and the feeling of belonging to something bigger than yourself. So what they found in this study is that after 12 months, there was a significant reduction of anxiety. And this is 12 months after the treatment. So the recovery was after the treatment, and it was steady and stable after 12 months of treatment. Another study done with patients who have cancer in using psilocybin. 2 studies have been done recently. One was done in 2011 by Grof et al. And what they did is 12 patients, and they did a double-blind crossover placebo. So they compared placebo with high dose of psilocybin in patients who had cancer. And what they found is an improvement in patients taking the psilocybin as compared to the patients who had placebo. There was an open-label trial. Most of the participants were women, and also some of these participants had an experience with psilocybin in the past. So we could hypothesize that there could have been a self-selection bias in this study. Nonetheless, more recently, Griffin et al., they had a study with 51 patients. So this is already a good sample size, and they did a double-blind randomized crossover study. And instead of placebo, what they compare is microdosing versus high doses. So low doses was the placebo one. And what they found, as we can see in this image, it was a significant response rate as compared to microdosing for those patients that took high doses. And because it was crossover, in the end, everybody got the high dose. But everybody who got the high dose, after 6 month follow-up, they had still a significant reduction in anxiety and depression. So here we can see the depression score in the upper part and the anxiety score in the lower part, on the left side. And on the right side, in the upper part, what we see is the remission. So there was a significant reduction in remission as compared to microdosing, and also this was stable after 6 months. And also in anxiety, a significant remission of anxiety that was stable after 6 month follow-up. So this study is very important. It's very encouraging for the use of these medicines for patients who have anxiety and depressive symptoms related to cancer and this kind of ontological anxiety of not knowing what may happen after you die. And based on that, there is now actually a phase 3 clinical trial going on in NYU that is being done at the Hefter Institute. So as we know, phase 2 clinical trials are helpful to see if these medicines can be safe. And actually, these trials found that these medicines are safe for the use in these patients who have also these medical important comorbidities. And based on that, now just knowing that they are safe, we are doing a phase 3 clinical trial to study the benefit of these medicines, mainly focus on see how beneficial can these medicines be used for the treatment of anxiety. And not only these medicines have been tried in patients with cancer. We have tried these medicines already only for the treatment of depression, for patients who have depression only. There is an open label study that was recently published at Lancet Psychiatry where the patients took 2 oral doses of psilocybin. First, they took a lower dose of 10 milligrams, and it was followed by a higher dose of 25 milligrams. And there was 7 days apart between these 2 doses. What they found is a reduction of the back depression inventory anxiety symptoms after 1 week. So after 1 week, there was already a marked significant reduction and a high remission rate in these patients. And it was also stable after 3 months. And these were patients, important to note that these were patients who had treatment-resistant depression, who had tried already 2 different kinds of treatments for depression. So this, again, is very encouraging to see if we can use these medicines in our clinical practice, these findings. Not only psilocybin has been tried for cancer-related anxiety and treatment-resistant depression, there are already open-label trials to see if this could be beneficial for the treatment of addiction. So not only there are no case report or studies showing that these medicines can cause addiction, despite they are FDA-controlled medicines and they are controlled, and people have the fear that they could cause addiction, that they are drugs that can cause addiction. So we don't have actually studies showing that these medicines cause addiction, But we have studies showing that these medicines can be used for the treatment of addiction and substance abuse disorders. So we have one study that they were used for the treatment of tobacco dependence with an 80% abstinence. These are open label studies. Another one for alcohol with a marked reduction in the drinking. And also, of course, what do we use for obsessive compulsive disorder? We use clomipramine, we use fluvoxamine, so we use serotonin agents. So these drugs are non-selective serotonin agonists. So there is one open label study with 9 patients who had obsessive compulsive disorder that saw reduction in the Yale Brown obsessive compulsive scale between 23 and 100% reduction. Ayahuasca is very popular nowadays for people who go to Peru, for spiritual journeys, for self-healing. Ayahuasca is a brew compounded by DMT and harmine. Harmine is a substance that allows for the brew to be digested and go to the main system and the blood flow. Ayahuasca has been used in clinical settings and research settings for depression. And we have 2 studies. We have an open label study down in Brazil with 6 patients that had treatment-resistant major depression, and it found that ayahuasca could be safe and also it could be beneficial, and it caused also significant reductions in the Montgomery Adverse Depression Rating Scale at day 1, at day 7, at that day 21 after treatment. So people took the ayahuasca only one time, and this treatment was improved after 21 days. So 3 weeks after the treatment, people still saw significant reduction of the symptoms of depression. There is also already a double-blind control study. And in this study, they had 35 patients with treatment-resistant depression, and there was a high comorbidity of borderline personality disorder in these patients. So what they found is actually people responded to placebo very close, the response to placebo as compared to the response to the ayahuasca. The authors explain that the high comorbidity of borderline personality disorder would be the explanation that the response to placebo was that high. Nonetheless, at day 7 days after the treatment, they found that the response to ayahuasca was 64% versus 27% in people who took the placebo. So we can hypothesize that the placebo effect was winning off at that time at day 7, and we can attribute the improvement in the ayahuasca group related to the medicine in this patient population. It was found safe actually in those 2 studies as well. So based on that, we decided what can we do to do some research and see how we can contribute to the science. So we started a group called Psychedelics and the Future of Psychiatry at the meetup in Chicago. And there a lot of people joined this group, people who were professionals, people who were psychologists, psychiatrists, pharmacists, therapists, counselors, and also lay people who were interested in psilocybin and see how it could be helpful. And so people who joined actually were people who had been involved in psychiatric care, people who had been patients in the psychiatric system, people who had a history of depression and anxiety. And what we found is like a lot of people are using nowadays, some people are using psilocybin at microdoses to treat the depression, and they are reporting that it's being beneficial. So psilocybin microdosing has been used to treat depression, anxiety, and also people use it for cluster headaches. So what they do, the practice is to use a very, very small dose, a dose that wouldn't cause an altered state of consciousness, a dose that wouldn't cause transcendental or ego disintegration symptoms, but a dose that would be good enough to enhance the serotonin in the system. So it's 0.3 milligrams, a very low dose, that is taken every 3 days. So we thought, well, if people are using this already in the community, and this has not been taken to research, it's important that we take this to research. So now we have 2 proposals that we're trying to do in our departments, in our universities. We want to do 2 studies. First, we want to do an open label study to address the issue of safety. So we would like to take 15 patients with treatment-resistant depression and treat them for 8 weeks with microdoses of psilocybin and see if this is safe, and in the meantime see if this has an antidepressant effect. Because as we saw in the other studies, lower doses in only one time might not be that beneficial, but if you can take lower doses in a prolonged period of time, it may be as beneficial and at the same time people wouldn't have to deal with the potential altered state of consciousness effect. So we want to study that. And after that, we would like actually to compare psilocybin with other medicines that we have available in the market, such as SSRIs, or maybe compare it with placebo, and see which one could be more beneficial. If they could be as beneficial, less beneficial, or more beneficial. So again, we're not trying here to defend psychedelics for recreational purposes. We want to see if these medicines are helpful or even more helpful or maybe less helpful than the drugs and the medicines that we have available in the market. So we're really interested in answering this question for the sake of science. So thank you for the people that came yesterday. Thank you for the people who are listening to us today. These are our emails, and please feel free to contact for any questions and collaborations. There are some web pages for patients who, psychiatrists who have patients who have used these medicines that you can access to, and Dr. Brown is gonna comment a little bit on that.
Right. So as Fernando said, thank you very much. Appreciate your time. Please feel free to contact us. We'll put some links in the notes of this presentation. Number one, to the meetup group that we talked about. If you'd like to continue this conversation, I highly recommend that you join. You can see the previous discussions that we have had, and we hope to start live streaming a little bit more effectively and allow people that are not able to be in Chicago to participate over the internet. Additionally, we'll put some links to the sites such as Erowid.org, drugstory.org, and also Dr. Jim Fadiman's site, who is trying to study this phenomenon of microdosing by collecting a number of different case reports. So please look below in the notes for all of those. Thank you once again. I appreciate your time, and have a good rest of your day.
Bye-bye.